let's see here. We're gonna do this. Let's turn that on. Let's get you all. Hey. I need to bring that in some. Let's get you all a question on the screen. I hope you all are having a fantastic day and welcome in. Welcome in, welcome in, welcome in. I have missed you all. Look here, it's cold in Florida. Save us. It is cold in Florida. And so once we start getting you all on here today, we're going to talk about different locations in which you can feel a pulse. And so we'll give you a few more moments. Let me try to put a question on the screen. And as you come in, hello, is it Midnight? Hi, Midnight. How are you doing? I hope you're having a great day. All right, for some reason it's not letting me put a question on the screen today, but we're gonna talk about those pulse points. Hey everybody, welcome in. How have you been doing? How was your weekend? What is the temperature where you're located? Because we're in Florida and we're not used to 20-degree weather for a prolonged period of time. And that's what we're experiencing right now. So, all right, looks like we have about 10 people. Once we get about 15 people, we'll go ahead and start with our review. So welcome in, welcome in, welcome in. Hello. Hey, Kiara. Oh, you worked, Alicia? Hold up, Alicia. You made money. So that's not really boring. That's you being productive. But my weekend was good. I worked also. I worked a little bit. Hey, everybody. All right. So we have 15 people. So we are going to start talking about the different pulses. And while I'm pulling up everything on my end over here, if you have questions, feel free to put those in the chat. I know some of you all may have tests coming up this week, and so I'm praying for you in advance that you just pass those examinations. If you're one of our channel members, it's hard to see on the screen, but I went ahead and I added the infograph into the actual channel member, so you'll be able to see all the different pulse points. And it also has information that tells you how to locate the pulses and what the ranges actually indicate. Hey Simone, how are you doing, dear? So if you are the channel member, I don't come on to do a whole bunch of lives in the channel membership, but instead, anytime I create a document, I upload it. So that way you can continue your studies. And that's just a way of saying thank you for supporting us and that we appreciate you. All right, hey Kiara, I don't know if I say Kiara. All right, so far we have 3 people who actually said hello, and we're going to get started with the different pulses. So welcome everybody. All right, so when you think about a pulse, and I don't like how that green screen is malfunctioning right now. So when you think about taking someone's pulse, what you're actually determining or what you're feeling is how the blood flow is moving through the arteries. And so every time the heart beats, depending on where you place your fingers, you're going to feel a pulsation. So that's the difference between a pulse and when we say heart rate sometimes. A heart rate, your nurse may put the stethoscope on the chest, and we're opposite. This is my left side, I promise you. The nurse will put the stethoscope on the chest and she listening to the heartbeats, how many heartbeats per minute, and that should coincide with the pulses, because every time the heart pumps, blood, it circulates through the body, and at different points you should be able to feel a pulsation. The pulses have different characteristics. Sometimes they're going to be really fast and thready, and that means like it's so fast that the blood is not pumping effectively. So that's why we say if a patient's heart rate is too high or too low, they can get dizzy. So when it's too fast, not enough blood flow is getting to the brain. Also, when it's too slow, same exact thing. So when you're feeling for a pulse, you have to be pretty accurate, because based upon your numbers, you're going to get that nurse in that room a lot faster. So everybody, let's start off with the radial pulse. For this one, I'm going to take off my watch. The radial pulse is located in the wrist. I'm going to bring that a little bit closer. So the radial pulse is in the wrist. Now, if you try to take someone's pulse with their hands up, what's going to happen with the blood flow, circulation? That's right. It's going down. So whenever you have your patient in the bed, it's just best to have their arm at heart level, and then their wrist. Okay, it's kind of hard for me to show you dependently. That way the blood flow is going down and you'll be able to feel the pulse better. But for now, what I want you to do is I want you to feel your own radial pulse. The pulse is at the base of the thumb, and you never feel for the pulse with your own thumb because your own thumb has its own pulse. So technically, if you did this, you're counting your own heart rate. So you're going to take 2 fingers or 3 fingers, both are allowed, and you're going to feel the radial pulse. During your CNA examination, you have to count that pulse for 1 full minute. So what you do in the real world, when you count for 15 seconds and multiply that number by 4, you cannot do that during your test. What do you do if you lose count? Because you got the clock ticking, you got a nurse looking at you. So if you lose count, you simply say, correction, ask if you can start all over again. Okay, sometimes we lose count. Sometimes we're losing count because our patients' heart rates are just either too fast or too slow, or we're nervous. And so if you lose count, what you're going to do instead is you're going to start on the other wrist. So remember, for your test, you don't have to just be stuck on one side, because maybe a person's pulse is stronger on one side than it is on the other. A lot of times people like to think that remember, we're opposite, that the side of the body that the heart is on, that it's just automatically the pulse is going to be stronger because it's closest to the heart. That's not always the case. This person could have had surgery. They could have had, anything happen to that extremity. So the best rule of thumb is to check both, because they both should feel about the same in a normal adult. So count the radial pulse for 1 full minute. Now let's go for the carotid pulse. So the carotid pulse is in the groove of the neck. So carotid pulse, and you don't want to feel both of the carotid pulses at one time, because if you do, you would cut off circulation to the brain. So whenever you're feeling for a carotid pulse, it's on one side. Normally, as a CNA, that's not a pulse you're going to feel for unless your patient's unresponsive. Because whenever we start palpating or touching arteries, they could have plaque and cholesterol. And so if that plaque breaks off, it can cause them to have a stroke. So normally only doctors feel for carotid pulses, or in an emergency, when you're tapping on someone's shoulder who's unresponsive and you say, hey, are you okay? And they don't respond, immediately hit that panic button, feel for the carotid pulse while checking for breathing simultaneously. And for the carotid pulse, for an emergency, you're only checking it for 10 seconds. If you don't feel any pulsations, you are to assume that they're in cardiac arrest. All right, next let's go to the brachial pulse. Gotta move over some. Sorry, my green screen is acting up. I'm just gonna remove it. Now I don't have an arm. Okay. For the brachial pulse, everybody, the way I like to think of the brachial pulse is that it's in the break of the arm. So what you can see, you see that? That's not an artery. That's a vein. So when you're feeling for the brachial pulse, you're not going for what you can see. Veins are deep. Arteries are deep. So you're not going for what's just visibly there, because that's where we do venipuncture. Venipuncture, drawing blood from a vein. The brachial pulse, the easiest way to get to the brachial pulse is I want you to trace from your pinky up to the break of your arm. Brachial pulse is in the break of your arm. So trace from the pinky up. What's the significance of the brachial artery or the brachial pulse? That's where your stethoscope's supposed to go when you're listening for a blood pressure. But because a lot of you all don't know that, you put the bell, the diaphragm of the stethoscope right there on the vein, because that's what you can see, and you assume that it's the brachial artery. It is not. Remember, arteries are deeper. So radial, carotid, trace the pinky up, brachial. And I like to make a clamp. So that's my little trick to make sure everything's stable, is the thumb is there for support. So I'm not feeling for the pulse with the thumb. I'm clamping down with my pointy, my middle, and my ring finger. I'm going to clamp down on that artery, and then I'm going to use my thumb for support. So now practice that with me on your wrist, radial pulse. And now clamp and support with your thumb. and you're going to feel those pulsations. You're going to count those for 1 full minute. All right, let's go to the next one, you all. The apical pulse. Imagine that my shirt was off or your patient's gown was up. This is something that your nurses listen to, especially whenever they're given a medication called digoxin. So for digoxin, that's a medication that slows down the heart rate because this person's heart rate is too fast. Usually they're in their abnormal rhythm called atrial fibrillation. So when you look at the monitor and you see these little quivering lines, but you're going to see a QRS, quiver, that's atrial fibrillation. That means that that patient's heart is fibrillating. They're at more risk of throwing the clot and having a stroke. So in order to control their heart rate, they'll be put on digoxin. Digoxin slows the heart rate. It can slow it too much. And so your nurse is supposed to put stethoscope to chest and go to the 5th intercostal space. That means you have to raise the breast tissue. And she's going to be listening to the apical pulse for 1 full minute. I'm going to move over so you can see that image. There it is right there. Apical, 5th intercostal space. For a woman, have to lift the breast tissue and you're going to listen. Remember, this is my left side, I promise you, but the camera has it backwards. Next is going to be temporal. And so for the temporal pulse, if you put your fingers in front of your ear, right where your hairline is, you're going to feel pulsations. When does that come into play? When someone has a headache and they're like, my head is pounding. More than likely, you can feel the temporal pulse. And also, whenever we're doing a thermal scanner, sometimes we start from here and work our way, or start from here and work our way there. It's going to have more blood flow in that area. Let's see what the next one is, team. Oh, the next one is femoral. Okay, so for femoral, hopefully you all can see, that's the groin area. Why would you have to feel for a femoral pulse? Because your patient just has some type of procedure. Maybe we're checking to see the blood flow in their lower extremity. And also in emergencies, we can feel for the femoral pulse also. And so the femoral pulse will let you know if your patient has blood flow to their legs. If you don't feel anything in the groin area, where chances are that leg is probably pale and probably cold to touch because the blood isn't circulating that far down. The next one's going to be popliteal. Say it with me, popliteal. It's kind of hard to see it on this image, but our channel members get the whole image and they'll be able to see it. So the popliteal is behind the knee. And let's go to the next one. And I'll be looking at whatever questions you all have in a few moments. The posterior tibial pulse. And so that one's inside of the ankle. You're going to go inside the ankle. Let's see if I can move the camera. And again, whenever we're checking those lower extremity pulses, we're doing that to see if our patient has circulation to their feet. So let's say it's a diabetic and they're already having sensation issues. I need to go ahead as the nurse and feel behind the knee for the popliteal, feel the posterior tibial, and then I also have to feel the dorsalis pedis. What's that? That is the pulse that's on top of the foot. So carotid, radial, brachial, femoral, behind the knee, popliteal, keep going down. The posterior tibial pulse is inside the ankle, and then the dorsalis pedis is on top of the foot. So those are the pulse points. I hope you learned a lot. Quick little overview, and I hope you actually understand the reason that we check these different pulses. So now I'm going to go and look in the chat. Let's see what all I missed. Zekin, yes, you can ask, what am I teaching? I'm teaching about pulsations and assessments for my CNAs and my future nurses. Let's see, when are you doing the CNA exam? Nicole, I know that we're doing one on Thursday at 6:30 because I'm going to be on with Sandy. Sandy just passed her CNA exam. And so if you all pass your exams and you actually came to our classes in Florida, or you're a channel member, you passed your exam and you want to get on here and go live with me, you can do so. Just got to send me an email and I'll send you an invitation. And then that way you can actually go live and help me. You can be my moderator. All right, so someone held a for review. I'm happy they held that one for review. You got big muscles. Tristan, stop it. Hello, Michelle. And then Nicole is in New York. And then Persipi, I think I said that right, said hi. And then Nicole said March. So Nicole, your test is in March. What questions do you all have before I end this live stream? I'm so proud of you, Michelle. I am so proud of you. If you have any pointers for the test, go ahead and put that in. Congratulations. Next stop is whatever you decide to do, whether it's nursing, respiratory therapy, radiology, business owner, you can do it. Hi, Sharon. All right, let's see if we can pull up some more questions. Let's see what we have in here. I may have to pull up some questions from last week. No, y'all don't want that one. Oh no, I got too much going on in my phone. So it's not safe for me to pull up more questions right now. Y'all are gonna see everything I did this weekend. You're so welcome, Kiara. Y'all don't have any questions? Y'all must be freezing like I am. Y'all don't have any questions about anything. Betty, I know you're going to do well. We have all those practice questions. In addition to the practice questions, we also have our CNA book. And then on top of the CNA book, we have the clinical skills videos. So we are here as a resource. Take what we teach you and then, just make sure that you verify what your instructor is saying. But I know a lot of times your instructors sometimes are not the most competent. We've been doing this now for almost 20 years. So it doesn't matter what state you're in. We know how to help people pass this examination. So we thank you for actually watching our videos, for liking our videos, and also for, just being on our channel. All right, let's see who else. Any other questions? Look at my face. Y'all got me. Y'all got me for another 3 minutes. You got to put some questions in the chat. You got a question about something. So y'all don't have any questions? Hi, Corrine. All right, I'm gonna ask you all a question then, since you don't have any questions for me. When you are taking your examination and your skill is respirations, why can't you tell the person that you're there to check their respirations? And what word do you say instead? What do you say? Our next live, Kiara, is going to be Thursday at 6:30. We're doing a CNA live Thursday at 6:30, I promise. You have been given the skill respirations during your state examination. However, you can't say the word respirations. Why not? And what do you say instead? So Betty says, I'm going to take your radial pulse. Nicole says, vitals. But why? Why can't we just tell the person, hey, I'm going to check your respirations? What are they not going to do? You're looking at them, they're looking at you. Guess what's not moving? The chest. So whenever you tell someone that I'm here to take your vital signs, we don't always say we're here to take the pulse, Betty, but I understand why you said that, because oftentimes to keep the element of surprise, we hold the pulse as if we're counting their pulse rate, but instead we watch their chest rise and fall. So if you go in there and you tell a resident, hey, I'm here to count your respirations, they're not going to breathe. Your numbers won't be accurate. What does apnea mean? When we say your patient is apneic, what does that mean? That's right, they'll be uncomfortable. The patients may start breathing faster or slower. That is right, team. What does apneic mean? Why can't you check the carotid on the left with your right hand and vice versa? You're supposed to check it on the side nearest you. If you're talking about personally, I won't be checking my carotid because I don't want to be just pressing my carotid arteries, because again, the more that you actually take a carotid pulse, the more likely you are to break off that cholesterol or plaque, and it can cause a stroke. So we don't really check our own pulses, and when you're with a patient, you check on the side nearest you. So if someone told you to cross over, that's not what we teach you here. So I would just question that, because whenever you cross over, to me, it looks like you're choking the person. So don't be crossing over because your thumb is going to touch the other artery. Instead, on the side that you're on is where you'll feel the carotid. I may be wrong, but that's what they tell you in American Heart Association world. All right, so let's see here. The patient may start, why can't you do that? Acidic, and then nice hairstyle. Thank you so much. I appreciate you. Learn, teach, transfer knowledge. All right, so what does apneic mean? No one gave me the answer. What does apneic mean? I just added something. I don't even know how to fix that. I don't even know what I did, y'all. All right, I'll put that there. What does it mean to be apneic? It's not acidic, apneic. When someone has apnea, that means it's the absence of breathing. They're apneic, like sleep apnea. When the person is sleeping and then they have periods in which they're not breathing. So if somebody has sleep apnea, tell me, how long do you have to count their respirations? For somebody with sleep apnea, how long do you count their respirations? I am trying to look. I don't know how to use this today. It's not being my friend today. All right, I don't want a light on. Turn that light off. Retouch. Don't laugh at me. There we go. I want to cancel that. There, I figured it out. There, got rid of it. You're not sure you're from which country? I'm from America. I'm Black American. 10 seconds. That is right. That is right. No, not 10 seconds. That's wrong. It's 10 seconds for the carotid pulse. So whenever someone has sleep apnea, anytime something is irregular, you have to count it for 1 full minute. So not 10 seconds, it'll be 60 seconds. That's right. It is 1 full minute. Because you all are smart. Orthostatic blood pressures. Why do we perform them, and which do you perform first? What's the purpose of orthostatic blood pressures? Year-round fun. Great job. Hey, Jesse. Look, Jesse, I am a geek, and I love being a geek, and I love educating you all. So if that's people are like, hey, Eunice, you need to teach different content. And I'm like, no, I only want to talk about medical stuff. Sorry. I'm in Florida. I'm in freezing Florida because it's cold out there. All right, so orthostatic hypotension. I give you the answer. Why do we do orthostatic blood pressures? And which reading do you perform first? My team is laughing at me because I've been giving answers through this whole live stream. Hey, everybody. I have missed you all. I'm going to keep asking questions until you all give me some answers, because y'all are not asking me questions, and you're welcome to ask me questions. Hey, Brandy. Ask me a question. All right, I'm going to ask you another question. I'll answer the first one. So for orthostatic blood pressures, the reason that we perform them is because this person is having orthostatic changes, or at least we think they are. What does that mean? With movement, with repositioning, their blood pressure is dropping. And so whenever your nurse asks you to get the orthostatic blood pressures, you're going to do the first one while the person's laying in bed resting. That one more than likely is going to be normal. And then you're going to sit the bed upright, or you can have them sit on the edge of the bed. Make sure you have a hand on them, because we know that with position changes, this person's blood pressure is lower, or at least we're suspecting that. And so you're now going to do one with them sitting over the edge of the bed. You're going to do another blood pressure. More than likely, this one's a little bit lower than the first one, because what happened with the position change? the blood is now going towards the legs, which is why we have you put those anti-embolic stockings on your patients, those TED hose, and you're supposed to put them on while the patient's in bed, not while they're sitting upright. All right, but patient sitting upright, you do the next blood pressure, it's a little bit lower. Lying, sitting, the last one you will do is with them standing. Make sure you have your hands around them in case they get dizzy. If they have orthostatic pressures, that one with them standing is going to be significantly lower than the one with them lying. And so that means that that patient's blood pressure is dropping. We're going to have to put those TED hose on them, those stockings, and on top of that, they're also going to be a fall risk because if they stand up, they reposition themselves too fast, they're going to get dizzy. Speaking of which, that's why you don't reposition your patients fast. It's you let them sit on the edge of the bed for a minute or two. You can be putting their shoes on, their socks on, not their TED hose, their regular socks on while they're sitting on the edge of the bed before you stand them up. And immediately upon standing them, you ask, are you dizzy? If your patient says they are dizzy, you don't walk them, you put them right back in the bed. All right, so patient stand up. Yes, yes, yes. Great answer, Kiara. Learn, teach, transfer knowledge. How do you stop smoking? That is a great question. Depends on what you're smoking. Cause some people smoke some other stuff. And so I'm just gonna talk about nicotine cessation. So they have nicotine cessation classes. On top of that, they also have patches you can put on. But if it's something more than that someone's been smoking, I'm gonna actually advise them to actually seek counseling from a therapist because there are some other activities that they can do instead, maybe walk. So try to find something that you do enjoy versus just going cold turkey, because if you go cold turkey, you can start having withdrawals, you can become irritated, or what a lot of people do is since they can't smoke, they start eating. And so there has to be healthier ways. And for anybody who's afraid to have a therapist, can I tell you I have a therapist? I meet with my therapist about once every 2 months and we talk about life, and she gets to tell me things that nobody else would tell me. So, and vice versa. So if someone's really serious about smoking or, the stop smoking cigarettes or marijuana or wherever it is they're smoking, start with some type of online cessation classes first. Find healthier ways to cope for whatever. Usually when they're smoking, it's because their nerves are bad, they're getting anxious, people are stressing them out. So try to get rid of some of those stressors and then try to find a healthier way instead of eating. All right, changing positions. That's right. What's your age? I am almost 50. It's why a person had a stroke or heart attack, they don't lie them straight down. So with the stroke or a heart attack, that is a freaking awesome question. With a stroke or a heart attack, usually their heart, I don't know if you all know the singer Ray J. Ray J just said that his heart is only functioning at 25%. So whenever someone has heart damage, usually their heart isn't pumping well. And those fluids, when the heart isn't pumping, it actually goes into the lungs. So if the heart isn't pumping, the fluid has to go somewhere. It's going to go into the lungs. You'll also see like their legs are really swollen. So the reason why we don't lay someone all the way flat when they have a heart condition, such as a heart attack or a stroke, is because more than likely the pumping capability of their heart, their ejection fraction has decreased, which puts them at an increased risk of having breathing problems. I love that question. All right, let's go to another one. When we smoke, we feel relaxed, and I feel stress relief. Okay, ashwagandha. I take ashwagandha because I don't want to smoke anything. So ashwagandha is natural, and it helps to decrease your cortisol levels. So maybe when you get your lab work done, see what your magnesium is, your potassium is, and your cortisol levels are, so that you sometimes don't need to smoke. You just need to change your diet and get rid of the stressors. Tell people to leave you alone. All right, everybody. I've had fun with you all. I love you all. Remember, we're going live again on Thursday at 6:30 for CNA, and that one will be really, really, really live. So more than likely, we're going to have like internet issues, etc. Be praying for us. But I'm going live with Sandy, who just recently passed her CNA exam. We are so proud of her. She's from South Florida, and she's going to let you know about her testing experience, and she's going to help motivate you all. So I'll see you on the next live, everybody. Bye.